they go in the trash, unfortunately. And they do have a charge cord as well. If your patient's going home, please send them home with the charge cord. I had to run out to Westlake on Saturday because a patient was sent home, not from here, but without a charge cord. Not what I planned to spend Saturday doing, but just please make sure they go home with it. Usually they come from surgery with this white bag, and that's where the charge cord should be. It's also a 2-part charge cord. Okay, so you just have to make sure it's plugged in to itself and into the unit. With the Provenus, let me just turn it on. Whenever you have a leak alarm, just so that you know, usually a lot of times this is the culprit, because this little guy can get tugged really easily and it's pressed on manually. So that's always like your first spot to check. And you can always take off the canister, pop it back on, see if that fixes the issue. It should be pretty quiet if we have a good seal, which my dressing is sketchy at best, so I might not even get a seal. It's been sitting in my car. But with this pump, so this is a 14-day pump. We also have a 7-day pump, so it's kind of confusing. We're trying to get everybody to just use the 14-day pumps, but they look exactly the same aside from the fact that this has a little calendar with a 14 on it. Now there's 7 lights around this power button. On the 7-day pump, every day 1 light goes out. So if you have 1 light left, then you know you only have 1 day of therapy left. Same for the 14-day pump, but the first 7 days the lights all stay on, and then the last 7 days, again, 1 day, every day 1 light goes off. This is your little battery guy, so you know it's charging and it's fully charged. This X is for a blockage. The line coming out is for a leak alarm. So if you're having a hard time managing this, maybe your patient just came from surgery and like you feel like maybe this just isn't strong enough yet, you can always hook it up to your big machine. There's a Provenus setting on here. I'll show you guys. And it's kind of nice because, so here, on your home, you do have to stop. When you turn your machine on, this should pop up, and it has Veriflow, VAC, Prevena, and Apthera. So under the Prevena setting, you can't change the settings. It's 125, and that's what the Prevena pump is. And you just hit okay, and it's purple, like the purple Prevena sponge. But here, there's an indication saying dressing seal okay to transition to the Prevena Plus 125, which is this guy. So if you're sending a patient home and like maybe it was a little bit finicky before, so now they're on this guy, or maybe they were just having a lot of drainage, so they decided to put them on the big pump so y'all didn't have to chase the canister, and now they're going home and you're going to put them on this pump, you want to get this seal check indication. It'll give you a little check mark right here if the seal is sufficient for the Prevena pump to handle it. Does that make sense? Okay. And again, this will run on battery for a pretty good amount of time. My husband actually had one last year for a knee surgery, and he was off of his charger from like 6 a.m. to 10 p.m. and it was still going strong. I don't ever tell patients that. I'm like, 8 to 10 hours, treat it a little bit like a cell phone, give it a good little charge if you're sitting down. That way it doesn't run out of battery when they're out and about. But just make sure they go home with the charge cord. And then also, I do recommend utilizing the little carrier, because what happens is they'll accidentally drop it, and then the Prevena canister cracks, and so then again we have to run to their home and take them a fresh canister. So if we can send them home with this and encourage them to use it, then they don't have to hold on to anything, and it won't drop as easily. So anyways, that's really all that I have. Does anybody have